So I want to, we end every interview with a rapid fire. I'm going to ask you a question.
Oof.
You tell me the first thing that comes to your mind, and we'll go with that. One wellness myth you wish people would drop.
More is not always better, especially when it comes to sleep. So you want to sleep between 6 to 8 hours, because once you sleep beyond that, it's not good for your body. It interrupts your circadian rhythms and your REM sleep. So when it comes to sleep, also with other aspects of life, more is not always better.
Great. One daily habit that gives the biggest return on energy.
Movement. Movement is medicine. Whether you're going up and down the stairs, you're walking to the bus stop, you're walking from your car to the grocery store, you're walking on the beach, keep moving. Don't stop, because that's what's going to keep your lungs healthy, your heart healthy, your mind healthy, and your overall body healthy and support longevity. So please, movement. So important.
Great. Okay.
Try to do it every day if possible. But yeah, that's the biggest advice I give.
Okay. Your favorite treatment to personally receive at BodyWell.
Oh my gosh. I received so many of them.
You got to tell me your favorite. Yeah, no, listen.
I like things that help me relax, that lower my blood pressure, that slow my thoughts, slow my breathing. So oftentimes I like our treatment chairs do recline, and they become very comfortable. So I do like to get our facelifting facial at BodyWell. We offer a facial that's about 45 minutes that has both manual massage, has microcurrent, and it also has lymphatic drainage. So that's a treatment that I like to get. I want to get it more often, but I'm often with patients. So that's one of my favorite treatments. It's just very relaxing. It's soothing. It reduces your stress. It reduces your blood pressure, heart rate, and all of that. As far as things that show results, my favorite treatment is microneedling with exosomes or with brightening serums. Why? Well, we all know that microneedling produces an abundance of collagen when done properly and when done frequently. And as we get older, the collagen in our skin and our body starts to decline. So when you do treatments like microneedling, which sounds scary, which is not, it's painless because we use a great numbing cream, you get a robust response from the body for tighter, more collagen-rich skin. So
very good.
That is one of my favorites.
Cool. The longevity and health expert you admire the most right now?
When it comes to longevity experts, I really look up to Dan Buettner. He is a National Geographic Fellow that identified the blue zones around the world where people have historically lived
the longest
to 100 and beyond.
Right.
Places like Okinawa, Japan, Costa Rica, Sardinia, Loma Linda, California. These are places where people value social engagement, deep connections, living with intention and purpose, eating plants and beans, and also exercising naturally. Your sheep shepherds in Sardinia that go up and down with their sheep, the grandmothers in Okinawa that prepare food for their families and dance after dinner. These harmonious environments that he discovered. And he discovered longevity in these places. And the remarkable thing is that he didn't discover longevity in a lab or in a medical institution or in medical school. He went to these places.
Yes.
Yeah.
Okay.
He went to these places and really made a difference and brought that to life. And I really respect him for that. Although I am someone that believes in advanced diagnostic testing and improving metabolism and target interventions, I do respect and admire him as what he's contributed to the field of longevity.
Great. The most underrated lifestyle change for people in Miami Beach?
Balance. We think of balance as, I have to balance my food and I have to balance spirituality with professional, but Miami is known as a destination where people come to celebrate their wedding, or they come on vacation, or they come to experience the nightlife or the hotels or the beach. So oftentimes when I meet patients that are or when I meet people that are visiting Miami, they think, oh, I could never live in Miami. There's always partying here, and there's so much going on. It's just too fast paced, and it's just party, 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 party. And maybe for some people it's that way, but for a lot of other people, this is their home base, and it's important really to find balance.
Very good.
Yeah, really
Okay.
just find a life of balance when it comes to social engagements.
What's your biggest talent that people don't know you have?
Oh my gosh. Well, I do have a pretty good ability to dance.
Very good.
I can groove and I can get down, and maybe a little later I'll show you.
There
my
you
moves.
go. Wait till the party's at Bodywell, right?
Yes,
All right.
everyone's
Very
invited.
good. One thing you wish every patient understood before walking into any med spa.
When it comes to walking into a med spa, I think patients should know that you should come with an expectation of what is reality. There are patients who walk into med spas thinking that they're going to do one treatment, one little tweak, and all of a sudden they're going to look like a filter that they use on their phone, on their social media. They really need to ground their expectations to what one treatment can do, because oftentimes people need to do multiple treatments to really see the result or to feel the result when it comes to other therapies. But really having that expectation that is not a one and done.
Yeah.
That's never one and done. You will require maintenance either quarterly or yearly, depending on your age, and
Or weekly. No.
or weekly. But also, you may not even minimally invasive treatments may work well for you, and they may give you the result that you want. But you also may be a surgical candidate for treatments. So there have been times where we've told our patients, really, I think the outcome that you're looking for, you're more suitable for a surgical intervention. And here is, a wonderful plastic surgeon that I would recommend. And they're very appreciative when we're honest, when we're honest and we're clear with them.
Yeah.
So,
Yeah. I was at the Fontainebleau during a plastic surgeons conference, and I was there with a friend of mine who is substantially younger than I am. And we're sitting next to this plastic surgeon, and he says to the plastic surgeon, "So what do you think? I've got these wrinkles by my eyes." And the plastic surgeon said, "Oh, you don't need surgery. Maybe just an injectable will take care of it." And so then I turned to him and said, "So, Doc, what do you think about me?" He said, "Full facelift." So, be careful what you ask for. It clearly hasn't happened yet.